Hello, welcome to Physician Academy. Today we're going to talk about type 2 diabetes. All lectures in Physician Academy are meant for physician-to-physician education only and are not meant to be used for any other purposes other than educational. So today is type 2 diabetes. Type 2 diabetes is a metabolic disorder of insulin resistance, meaning that the patient's body no longer responds to insulin produced in the blood or doesn't respond adequately to the insulin produced in the blood. This occurs because of a downregulation of insulin receptors due to the presence of consistently high insulin levels. Usually it's brought on by a consistently high carbohydrate diet. The key is consistently high. So spot or binge abuse does not usually bring this on, but it's consistent over long periods of time of exposures to high levels of carbohydrates, also causing high levels of blood glucose. The diagnosis is usually done by history and physical. As with most medical problems, it should always start with a history and physical. Common symptoms and signs for type 2 diabetes is polyuria, polydipsia, polyphagia, unexplained weight loss, blurred vision, jock itch, vaginal itch infections, and commonly patients have obesity, acanthosis nigricans, all the signs of metabolic syndrome. Often people in the metabolic syndrome can be found to be pre-diabetic. Labs that we should do when trying to evaluate a patient for type 2 diabetes is a complete metabolic panel. Will show us an elevated glucose. Sometimes creatinine can be elevated, or elevated liver enzymes, indicating possibility of non-alcoholic steatohepatitis or NASH. Hemoglobin A1C should also be evaluated. This gives us an average blood glucose for the last 3 months, and when it's found to be greater than 6.5 is an indication of diabetes. 5.7 to 6.5 of a hemoglobin A1C of 5.7 to 6.5 is pre-diabetic. Fasting glucose of greater than or equal to 126 is another diagnostic criteria for type 2 diabetes. Also, glucose tolerance test, which is difficult to perform considering today's practice limitations. And glucose tolerance test is greater than or equal to 200 is a sign of type 2 diabetes. It's usually done 2 hours after an oral dose of high glucose. Also, a random glucose of greater than 200 is another sign of type 2 diabetes. So a normal patient should not have a random glucose of greater than 200 and should not, with a glucose tolerance test, shouldn't be pushing their sugars past 200 that easily. So once you've got a patient with type 2 diabetes, what do? There are a variety of treatment approaches. The following lectures will discuss all the different options for treatment. The best one is patient education, though. We should always start with patient education. The biggest problem with diabetes is patients, or type 2 diabetes, is patients need to understand the relationship between the foods they eat and their carbohydrate load and their insulin requirements. So if we can convince patients that their food is the problem, and if they can change their diet, they can solve this problem without medication, we've now helped the patient tremendously. So the suggestion is a low-carb diet. A good example of a low-carb diet is what some people would call the Fantastic Five diet, which would be 5 things in a low-carb diet: water, green vegetables, fish, chicken, and meat. If you notice, these are low glycemic foods. These are not the low-carb diet has been maligned in the past few years, and people think it's a high protein or going to cause other problems. You don't have to push the proteins, you just have to cut the carbs. And carbohydrates like breads, rices, grain products, tortillas would all increase, potato chips all increase or have high glycemic load and increase blood sugar levels. So afterwards, you can also talk about medications. Important medications is to understand that the medication requirement is based on the foods they consume. So you have to try to educate the patient that your medication needs are more for the foods you're eating, that if you change your diet, you'll need less medication, if you change it to a lower carb diet. If you increase your carbohydrate load in your diet, you'll need more in medications. And ideally, if they're going to go the medication route and not try the diet route, then they really need to be as consistent as possible. So we want to consistently decrease carb intake or keep a consistent carb load, and that's easier to treat with medications. Ideally, we'd like them to consistently decrease carb intake and thus decrease the medication requirement. If they have an increase in carb intake, they're going to need to understand that they're going to have an increase in medication requirement. So the mainstay of treatment for type 2 diabetes is really pushing a lifestyle modification. And what lifestyle modifications patients need are a low carb diet, as expressed earlier in the Fantastic Five, which is water, green vegetables, fish, chicken, and meat. Emphasizing water and green vegetables and less on the meat side of it. Exercise is important. 1 hour of exercise daily. More is better, but trying to get them to even start exercising is important. So even if they start with only 5 minutes a day and every week add another 5 minutes, that'd be fantastic. So what would our medications choices be? First line medications are metformin. And we're going to cover these medications in later lectures or later topics, so as you should be able to see a list of these medications. Metformin is our first starting line, though. The mechanism of action is not completely understood, but it does suppress glucose production in the liver, known as hepatic gluconeogenesis. It activates a AMP, or activated protein kinase, and it inhibits glucagon-induced cyclic adenosine monophosphates, and increases insulin sensitivity, enhances the peripheral glucose uptake, and decreases the absorption of glucose from the gastrointestinal tract. So it works in many ways and is considered the best first-line treatment for type 2 diabetes at this time. This concludes our introductory lecture to type 2 diabetes. Look for the following lectures on different medications, and we'll continue to add lectures as we go.